Hello, I'm Dr. Luna, and today I'm here to talk to you about something that can make a huge difference in the health and quality of life of our elders: medications. Sometimes, what is supposed to help us can end up harming us if not used with proper care. Imagine an older adult taking a pill to sleep better, but ending up more confused, at risk of falling, or suffering unexpected side effects. This isn't an isolated case, it's a silent reality affecting millions of families. Medications can be powerful allies, but they can also become dangerous if not administered correctly, especially in older adults. The body changes with age. What we used to tolerate easily can now have serious consequences. And often, neither the patient nor their loved ones realize the medication is causing harm. They blame it on aging, fatigue, or assume it's just part of the natural process, but that's not always true. Today, I'm going to share with you the 10 most dangerous medications for older adults. But not just that, I'll also explain why they're dangerous, what signs to watch out for, and what you can do if you or someone close to you is taking them. This isn't about fear, it's about knowledge. Because when we understand, we can make better decisions. And when we make informed decisions, we care with love. So stay with me until the end. This information can help protect the people you love most, because caring for health is also an act of wisdom. Let's begin. As the years go by, the human body changes in ways we often don't notice until something stops working as before. The liver, kidneys, digestive system, brain, they all age. And with those changes, the way the body processes medications changes too. A dose that worked fine at 40 may be too strong at 75. As we age, the liver may take longer to break down medications, and the kidneys take longer to eliminate them. This means the drug stays in the body longer, increasing the risk of side effects. Body fat tends to increase, and muscle mass decreases, which also affects how medications are distributed. A drug that was once harmless can now cause excessive drowsiness, confusion, or even serious falls. And let's not forget, many older adults take multiple medications at once. This is called polypharmacy. The more drugs someone takes, the greater the risk of dangerous interactions. Imagine combining a sleeping pill, a blood pressure med, and a painkiller. The result? Someone feeling weak, dizzy, or mentally foggy, without knowing why. Worse still, these symptoms are often mistaken for normal aging, memory loss, fatigue, mood swings. But sometimes the real cause is a poorly adjusted medication. And sadly, neither the patient nor the doctor connects the dots right away. That's why it's essential to understand that an older person's body is not the same as that of a younger adult. What was once safe now needs careful adjustment, thoughtful evaluation, and most importantly, open communication between patient, family, and healthcare professionals. Medicine is a wonderful tool, but it must be used wisely. It's not about fearing medication. It's about understanding, respecting, and adapting it to each individual's reality. That is true medicine, the kind that listens, observes, and cares with intelligence and compassion. One of the most commonly prescribed medications for older adults are benzodiazepines. Names like diazepam, lorazepam, or alprazolam might sound familiar. They're used to treat anxiety, insomnia, and sometimes depression. But what many don't realize is that these drugs, while seemingly harmless at first, can become very dangerous over time, especially for older people. Benzodiazepines directly affect the central nervous system. They relax, calm, and help with sleep, but they also cause excessive drowsiness, mental confusion, balance problems, and most alarmingly, a significant increase in the risk of falls. Did you know a fall in an older adult can completely change their life? A hip fracture, a long hospitalization, a loss of independence. All of that can start with one little sleeping pill. And sadly, these pills are often prescribed for months or even years without checking if they're still necessary. The body adapts. The mind too. And stopping them suddenly can cause withdrawal symptoms, severe anxiety, insomnia, tremors, or even seizures in extreme cases. But not all is lost. If you or someone you know is taking benzodiazepines, do not stop suddenly. It can be dangerous. Instead, talk to your doctor. Ask if they're still necessary. Are there safer alternatives like cognitive therapy, relaxation techniques, or other medications with fewer risks. The goal isn't to live in fear, but to live with clarity, a sharp mind, a balanced body, a safer life. Benzodiazepines can help in critical moments, but they're not meant to stay forever. Wisdom is knowing when to say enough and seek a better path. There's a group of medications that many older adults take without knowing they can seriously affect their mind and memory. They're called anticholinergics. Maybe the name doesn't ring a bell, but you've seen them. Some allergy meds, drugs for overactive bladder, certain old antidepressants, even pills for motion sickness or intestinal spasms. They all have one thing in common. They block a brain chemical called acetylcholine, which is essential for memory, learning, and clear thinking. In older adults, these drugs make the brain struggle to communicate with itself. The effects may be subtle at first, trouble concentrating, mood changes, but over time, the risk of cognitive decline and even dementia increases significantly. And often, neither the patient nor the family suspects the medication. They blame age, but it's not always age. These meds also cause annoying side effects: dry mouth, blurry vision, constipation, urinary retention. And in older adults, even small changes can have a big impact on daily life. The answer isn't to demonize these medications. In some cases, they're necessary. But we must always ask, are they really needed? Is there a safer alternative? For example, instead of a bladder drug, maybe try pelvic floor exercises. Instead of a strong antihistamine, maybe a gentler modern option. First step, get informed. Second, talk to your doctor. Third, take conscious action. A clear mind is worth more than 1,000 pills. In old age, every day with mental clarity is a treasure. Pain is one of the most common complaints in older adults: achy joints, stiff backs, tense muscles. And often the first thing people reach for is an anti-inflammatory. Medications like ibuprofen, naproxen, or diclofenac, known as NSAIDs, are common, easy to get, even without prescription. They seem harmless, but be careful. In older adults, they can become a silent risk. These drugs, while useful for pain and inflammation, can cause serious stomach issues like ulcers or internal bleeding. And if the person is taking aspirin or blood thinners, the risk multiplies. They also impact kidney function, which can lead to toxin buildup, high blood pressure, and other dangerous imbalances. The danger grows if these meds are taken daily for weeks or months without realizing the body can't handle them anymore. Especially risky is combining them with diuretics or blood pressure medications. It can further unbalance the body and cause unexpected complications. So what can we do? First, avoid self-medicating. Just because something brings relief doesn't mean it's safe. Second, look for alternatives: physiotherapy, warm compresses, light exercises, or safer long-term pain meds. And of course, always consult a healthcare professional. Pain can be treated, but with care, intelligence, and awareness. Not every easy path is the safest one. The script continues with similar sections on other high-risk medications for the elderly: antipsychotics, sleep aids, opioids, diuretics, tricyclic antidepressants, sulfonylureas for diabetes, and polypharmacy. There are times when an older adult begins to behave strangely: confusion, agitation, intense mood changes. This often happens in the context of dementia or after a long hospital stay. In such cases, some doctors prescribe antipsychotics like risperidone, haloperidol, or quetiapine with the intention of calming the person, helping them sleep, or reducing anxiety. But what many families don't know is that these medications can be more harmful than helpful in older adults. Antipsychotics were designed to treat serious mental illnesses like schizophrenia. They are not meant for occasional insomnia or the typical confusion that comes with aging. In elderly people, especially those with dementia, these drugs increase the risk of stroke, falls, deep sedation, and even sudden death. Yes, you heard that right. They can shorten life. And yet, they are still frequently used in care homes and hospitals to calm down difficult patients. The sad reality is that, instead of improving the quality of life, these medications often reduce it. The person becomes sleepier, less communicative, more disconnected from their environment. So what can be done? First, We must understand what's really causing the agitation. Is it pain, fear, discomfort, or an unfamiliar environment? Treating those causes can reduce the need for medication. Second, explore non-drug approaches, stable routines, natural light, soothing music, affectionate contact. And third, if an antipsychotic is truly necessary, it should be at the lowest possible dose, for the shortest possible time, and with constant medical review. Peace of mind should never come at the cost of erasing the person. Behind every confused face is a story, a dignity, a life that deserves to be cared for with respect and humanity. That is true medicine. Sleeping well is essential to health, but in old age, sleep often becomes elusive. Many older adults spend nights staring at the ceiling, eventually seeking medical help. That's when medications like zolpidem or zopiclone, known as Z-drugs, come into play. They seem like the perfect solution, just one pill and sleep arrives. But that quick fix can carry serious consequences. These medications act on the brain to induce sleep, but they also affect balance, memory, and reaction time. In older adults, this translates to a higher risk of falls at night, morning confusion, and a foggy mind during the day. They can also lead to dependence. The body gets used to them, and over time the same dose no longer works, prompting people to increase it without realizing the risks. And what's more worrying? These medications are often prescribed without checking the root cause of the insomnia. Maybe the person is in pain, depressed, anxious, or simply sleeps too much during the day. Treating the symptom without understanding the cause can lead to a chain of problems. Sleeping well doesn't always require a pill. Stable bedtime routines, avoiding screens before sleep, keeping the room cool and dark, reading, or listening to soft music. All of that can help. And if medical support is necessary, there are safer and less addictive options. Sleep is sacred, but it should never be achieved at the cost of losing clarity, independence, or safety. The night should be a space of rest, not risk. Chronic pain is a harsh reality for many older adults. Sometimes it's the back, sometimes the knees, or pain left over from surgeries or illnesses. In the search for relief, people often turn to opioids. Drugs like morphine, oxycodone, or tramadol are powerful and can relieve suffering, but they also hide dangers not always visible at first glance. In older bodies, opioids can act more intensely than expected. A standard dose can cause deep sleepiness, dizziness, confusion, or even breathing problems. And in someone who already has mobility issues or lives alone, that can mean a fall, a fracture, or a medical emergency. They can also cause dependence. The body and brain become accustomed, and when the drug is missing, withdrawal symptoms appear: anxiety, sweating, worse pain, insomnia. Even worse, the pain the person wanted to relieve may come back stronger, requiring a higher dose. It's a vicious cycle. But not all pain needs opioids. There are alternatives: physiotherapy, adapted exercises, warm compresses, massage, and even other less risky medications that can be combined to manage pain. The key is not to accept pain as a life sentence, but also not to let treatment become a danger. Talk to your doctor. Review every medication you're taking. Ask if there's a safer option. Pain relief is a right, but it must be done wisely, step by step, without sacrificing quality of life. Because calming the body should not mean shutting down the mind or risking the heart. Diuretics, commonly called water pills, are often prescribed to older adults to treat high blood pressure or heart problems. Medications like furosemide or hydrochlorothiazide help the body eliminate excess fluid, which can be very helpful in cases of swelling or breathing difficulty. But in older adults, these medications can act too strongly. Not only do they eliminate fluid, they also wash out essential minerals like potassium and sodium. That loss can cause muscle weakness, cramps, irregular heartbeats, or even fainting. Picture someone getting up at night to go to the bathroom, feeling dizzy and falling. It happens more often than we think. Frequent urination also interferes with sleep, causing daytime fatigue. And in many cases, the dose is never adjusted to match the patient's current condition, so side effects accumulate unnoticed. That doesn't mean we should eliminate diuretics. They're very useful when used correctly. But they must be closely monitored. regular blood tests, blood pressure checks, and careful observation of how the person feels. Sometimes a lower dose or a different schedule can preserve the benefits without the harm. The goal isn't just to manage a blood pressure number, it's to take care of the whole person. In old age, every smart adjustment makes a big difference. Depression in old age is real, but often hides behind silence, isolation, or phrases like, "I just don't feel like doing anything anymore." To treat it, some doctors still prescribe tricyclic antidepressants like amitriptyline or imipramine. These are powerful, older medications, but in elderly people they often cause more harm than good. They affect many systems in the body at once. One of the most well-known effects is their anticholinergic action, which can cause confusion, dry mouth, blurry vision, trouble urinating, and severe constipation. They also disrupt balance and blood pressure, increasing the risk of falls and fainting. Worse yet, they're often prescribed without proper follow-up. The patient starts them, feels slightly better or nothing at all, and keeps taking them for months or even years. Meanwhile, side effects build up and no one connects them to the medication. But there are better options now. Modern antidepressants like SSRIs, selective serotonin reuptake inhibitors, are much better tolerated by older people. And depression treatment doesn't rely solely on pills. Therapy, emotional support, physical activity, and social connection are powerful tools, yet often overlooked. Sadness is not a natural part of aging. Medicine can help, but not at the cost of stealing mental clarity, physical balance, or dignity. Always ask, is this the best path for this person at this stage of life?